I call him a tumbler. He's a person who basically, in Yiddish, it means that a person makes things happen, usually very noisily. Now, he doesn't do things noisily, but the fact is that he was the go-to person.
Nathan was an exemplar for service and research and teaching at national, state, and international levels. Why do I say that? Everyone that was doing AIDS work in Chicago knew Nathan. Everyone that was doing work in AIDS in Illinois knew Nathan. Everyone that was doing work nationally in the U.S. knew Nathan.
During his 27 years of service at UIC, Nathan created multiple training centers and organizations. He's taught in academic institutions worldwide with a passion for social justice. To call him our founder and fearless leader doesn't always feel like enough.
So I worked for 40 years as a social worker in various kinds of settings, and I got into social work before I came to SSA. In my college years, I did youth work of various types. It's all about the people and about finding ways to support vulnerable populations, particularly across cultures in resource-poor settings. So one of the reasons I'm passionate about it is because of the help. We can help people, maybe make a difference in their lives. And particularly since I work across different levels, maybe we can change the systems that will support them on an ongoing basis. In addition to all the other things, in addition to teaching, and I taught at Jane Addams College for almost 20 years, and I taught across the curriculum, and I was involved in committees and all the other things we do as faculty members, but I had these centers going under my jurisdiction, and I began to spread my wings and cross the borders and do more international work. My international experience really started in the 1990s when I began doing some work with medical providers and other providers in Romania. But more recently, I've been working in Africa, in the African context, particularly East Africa, trying to help develop social work education programs there, as well as ways of filling the gap in the social welfare workforce. So we developed something called parasocial work. And we called it parasocial work to be sort of like paramedics or paralegals or whatever. It's become an international best practice methodology. So it's been a very successful program. In Tanzania, we've trained almost 5,000 parasocial workers and parasocial work supervisors because we wanted to have a supervisory structure to sustain what they were doing. If we can make some dent in some institutional barriers, then we've really opened up opportunities for the future. So those are some of the reasons why I'm excited about it. The mission of SSA to be working towards a just and humane society through research, teaching, and service to the community, I think I've tried to use that as a model to live my own life. But I think that as a social worker, I bring something unique. I bring the perspective that we're working with the individual within their context in a large way. So I may do public health, but I'm not public health. I'm a social worker through and through, and SSA is who taught me how to do that and to be a part of it. So I think that this idea of filling the gap in terms of dealing with health problems, dealing with poverty, dealing with stigma, and the other kinds of problems that social workers encounter in these other countries is a very promising opportunity. But for myself, having experienced what I have, it sort of reminds me of the war on poverty. When social work sold itself too long, I think, that we might be able to go out and actually solve these problems. I don't think we solve these problems. We provide ways of intervening and trying to help individuals within the country to try to have some tools available to make things happen more effectively for them. When you think about the areas that I've been involved with, older adults, people who are experiencing losses, people who are dying, gay and lesbian people, people with HIV, people with disabilities, people with addictions. Many people say, don't you get depressed working with these populations? But for me, it's just the opposite. For me, it's very affirming. It creates an opportunity for me to be useful and to learn from them. And to think that my contributions are valued by my colleagues and peers here is really a very deep honor. So it's exciting to me to get this award at this time.
In 1988, it was really important for him to do this work because people were shying away from talking about HIV. We had a president, President Reagan, who was not addressing issues having to do with HIV. The first newsletters that came out of MATEC, he put his own picture on the front page of the MATEC newsletter, basically saying, look, I'm not afraid of this issue. Let's destigmatize this issue because it basically is preventing us from being able to do the kind of work that needs to be done.
He could talk and communicate to people at all levels, okay, on the street, in the hospital, in the clinic, academics, policymakers, folks at government levels. I mean, there wasn't a person that Nathan didn't know how to engage and reach.
Nathan was always thinking about systems, and he was always thinking about what kind of program could we develop that would address the issue.
You look at the criteria for the award, and you look at Nathan's career, and it's check and exceed, check and exceed, check and exceed, okay? You look for him in the scholarship of HIV and AIDS. He's there. He continues to be there. He still is an amazing teacher and instructor for HIV/AIDS education. You know, he's got books, he's got articles, and they continue to be classics in the field. So, you know, there's that kind of indelible footprint.
As an openly gay man living through the HIV epidemic and witnessing remarkable illness and death, Nathan has shared lessons about being an authentic human being, about remaining a fierce champion for safety, and about cultural humility. He has pushed through battles of turf and funding in order to promote health and well-being.
Of course, his service is without question. The service is miles long. And what's neat about it is that they aren't just titles. I mean, he did substantive work there as well. So when you add all those up, you've got somebody who really meets and exceeds all the expectations of the Edith Abbott Award. And I think if she were alive, you know, she and Nathan would probably be really, really good friends.